Hello and welcome to Parent-Child Excursions. This is going to be a discussion of coexisting ADHD, anxiety, and autism. You'll see that we're going to move beyond these categories of diagnosis to what we'll call a functional assessment of developmental difference. Specifically, we're going to treat ADHD, anxiety, and autism as problems along a spectrum of over-inhibition and under-inhibition that I'll refer to as SCADS, the self-control and attention dysregulation spectrum. Let me explain. In outline, we're going to first discuss how there are three levels of assessment. There are those categorical boxes that you're used to hearing about, anxiety, ADHD, and autism. There's the etiologic boxes, looking at what causes these types of differences. But what we'll focus on today is a third type of assessment, so-called functional assessment. What's going on in the brain that explains difficulties with under-inhibition, over-inhibition, and how that understanding informs management of anxiety, ADHD, and autism, especially when they coexist. Second, we're going to describe in much greater detail what this spectrum of under-inhibition and over-inhibition is all about. Third, how that understanding helps guide medication management. Fourth, how that understanding helps guide cognitive behavioral therapy. Fifth, a discussion of other behavioral disorders of over-inhibition and under-inhibition. And lastly, other neuropsychiatric and developmental disorders that can be thought of in these terms. I hope you find this discussion interesting and useful.